Hello and welcome to Chapter 11 in Pharmacology. This chapter covers drugs for emotional, mood, and behavioral disorders. So people suffer from depression for a lot of different reasons. This table talks about the situational causes of depression. And I'm just going to read through these. Unpleasant life circumstances, grief, divorce, loss of or dissatisfaction with a job, financial difficulty, excessive stress or responsibilities, childhood history of emotional or sexual abuse, negative thinking patterns, an environment that is likely to cause an individual to feel as if any attempts to escape or correct a situation are hopeless, poor self-image, or lack of support from family or friends. Substance abuse, substances that produce unpleasant or adverse effects or withdrawal symptoms, such as opiates, alcohol, or other central nervous system depressants. Medications, unfavorable adverse effects from medication intended to treat a medical disorder. Some antihypertensive drugs are this way, and oral contraceptives. There are biological causes of depression as well. Genetics, if there's a history of depression in one's family. Hormonal changes in the body, fluctuations of reproductive or metabolic hormones. Neurobiologic dysfunction, where chemical disturbances in the brain, usually related to abnormal functioning or release of neurotransmitters like dopamine, norepinephrine, serotonin, or melatonin. And symptoms from a second disorder, almost any debilitating disorder, including head trauma, dementia, brain stroke or tumors, chronic pain, or thyroid dysfunction, are all biological causes of depression. So again, there's situational causes of depression and biological causes of depression. Lots of different reasons that people become depressed. In order for it to become or be determined a major depressive disorder, the person must show at least 5 of the following symptoms. And this is over the course of the next 3 slides. So they must show at least 5. So difficulty sleeping or sleeping too much, extreme fatigue without energy, abnormal eating habits, eating too much or not enough, vague physical symptoms, GI pain, joint or muscle pain, or headaches, an inability to concentrate or make decisions, feelings of despair, guilt, and misery, lacks of self-worth, obsessed with death, expressing a wish to die or to commit suicide, avoiding psychosocial and interpersonal interactions, lack of interest in personal appearance or sex, delusions or hallucinations. So again, in order for it to be determined or diagnosed as a major depressive disorder, the person must exhibit at least 5 of those symptoms listed on the previous 3 slides. And those would be an important thing to know for your test. The types of depression are listed here on this page. There's situational depression, dysthymic disorder, which is when there's persistent mild depression, disruptive mood dysregulation is when it's unregulated, premenstrual dysphoric disorder, it's when there's severe irritability 2 weeks before your period. and it subsides generally 2 days before the period begins. Postpartum depression, seasonal affective disorder or SAD, and psychotic depression. So for best results, severe depression requires both medication and psychotherapy. The diagnosis of severe depression is completed through the use of a complete health assessment. Medical causes must be ruled out, such as drugs. Some drugs can cause severe depression, such as corticosteroids, levodopa, and oral contraceptives. And there are some medical and neurological disorders that can cause severe depression, and those include vitamin B deficiencies, thyroid gland problems, and early Alzheimer's disease. A psychological evaluation may be performed by a psychiatrist or a psychologist to confirm the diagnosis. And they'll look at alcohol and drug use. They'll ask about death or suicide. And they'll check the family history if another family member has been treated, and what therapies were used and which of them were the most effective. So a severe depressive illness, we mentioned, requires both medication and psychotherapy in order to get the best response. And there can be counseling therapies and also the behavioral therapies. And again, that's just an umbrella term, kind of, for the treatment of mental health disorders. There can be short-term psychotherapies where there's interpersonal and cognitive behavioral therapies, psychodynamic therapies. An example of that might be something called transcranial magnetic stimulation. There's something called electroconvulsive therapy, or ECT, and it's where there's electrical stimulation of the brain while the patient's under anesthesia. It's a traditional treatment for disorders unresponsive to drug therapy. So again, some of the treatments include short-term psychotherapies, psychodynamic therapies, and electroconvulsive therapy. Antidepressants work to enhance the mood by boosting the action of neurotransmitters, and that includes, we mentioned this earlier, norepinephrine, dopamine, and serotonin. And you'll notice there's some carryover from Chapter 10 into Chapter 11. So we do cover some of the same things that we talked about in Chapter 10, including these antidepressants. So antidepressants combat depression by enhancing the mood. They're often used off-label to treat symptoms like anxiety and restlessness. They can also be used in pain management. And the FDA has a black box warning on some antidepressants to closely monitor adults and children for warning signs of suicide, particularly at the beginning of treatment. And again, the four primary classes, which we talked about in Chapter 10, the four primary classes of antidepressants are the SSRIs, the atypical antidepressants, the tricyclic antidepressants, and the MAOIs, or the monoamine oxidase inhibitors. This slide goes over the SSRIs in a little bit more detail. They act by slowing the reuptake of serotonin into presynaptic nerve terminals. They are the preferred drug for the treatment of depression. We talked about that in Chapter 10 as well, SSRIs are the preferred drugs for the treatment of depression. And they have about the same effectiveness at relieving depression as the TCAs and the MAOIs, but they have a much greater safety profile. So that's why they're the preferred drug for the treatment of depression. The full effect of SSRIs takes about 1 month to achieve. So the person has to be on this medication for a month before they see results. Some of the adverse effects from the SSRIs include decreased libido and lack of ability to reach orgasm, and in men, delayed ejaculation and impotence. And these types of things are actually pretty common. And if a patient tells you that they're experiencing something like this, you want to encourage them to discuss it with their provider. Some other adverse effects include weight gain, nausea, headache, anxiety, and insomnia, and sometimes constipation. And you want to encourage the patient to add fiber and increase fluids when they're taking their SSRIs. And this slide is talking about something called serotonin syndrome, or SES. It occurs when an SSRI is taken with an MAOI, TCA, lithium, or a number of other medications, and some supplements. And St. John's wort is the supplement that can cause this SES to occur. And the symptoms include changes in mental status, hypertension, tremors, sweating, fever, and lack of muscular coordination, as well as mania and confusion. Renal failure is another potential side effect or symptom. It's a very serious occurrence, and again, only happens when there is an interaction between an SSRI and other types of medication, including the MAOIs and the TCAs, and also a supplement like St. John's wort. And what I want you to know from this slide in particular is the symptoms of the SES that I've mentioned. This is just another table listing some of the SSRIs, and we did talk about these in Chapter 10. And this is just a figure showing how the SSRIs inhibit the reuptake of serotonin. These next couple of slides talk about the atypical antidepressants. On this slide, they list Cymbalta and Effexor. Additionally, there's Wellbutrin. And with these medications, particularly the Cymbalta, and I may have mentioned this in Chapter 10 as well, but they can cause suicidal ideation. So you have to monitor for signs of suicidal ideation. They can also cause liver toxicity, and they also can lower the seizure threshold. And Effexor is probably the most common one on this slide. The Tricyclic antidepressants, or TCAs, actually named for the 3-ring chemical structure, and they inhibit the reuptake of norepinephrine and serotonin into the presynaptic nerve terminals. Primary use of TCAs is for major depressive disorders, but occasionally used for situational depression. And this is just a picture showing the TCAs inhibiting the reuptake of norepinephrine and serotonin. Some of the adverse effects of the TCAs include orthostatic hypotension, sedation, dry mouth, constipation, urinary retention, blurred vision, and tachycardia. With the orthostatic hypotension, that is the adverse effect that is most likely to occur. And as all of you know, orthostatic hypotension is when a person, if they sit up or stand up too quickly, their blood pressure drops, then they get dizzy. So you want to instruct the patient to not sit or stand or change positions rapidly so that they can try to avoid that orthostatic hypotension. TCAs continued, they can have significant drug interactions with certain medications, including these listed. They're less frequently used as first-line drugs in the treatment of anxiety mixed with depression, because those newer antidepressants are used. Remember, we talked about the benzodiazepines. And one serious side effect of the TCAs that we didn't talk about is urinary retention. So that's another downfall to using the TCAs. And here are a list of some of the more common tricyclic antidepressants. Elavil or amitriptyline is one that you hear a lot about. Sinequan is another one, and tofranil. On this slide, the Pamelor. And then monoamine oxidase inhibitors. Their action is to limit the breakdown of norepinephrine, dopamine, and serotonin in the central nervous system. The primary use is reserved for patients who don't respond to other antidepressant classes. So in other words, the MAOIs are used as a very last resort. Their adverse effects include orthostatic hypotension, headache, insomnia, diarrhea. Something called a hypertensive crisis can occur when MAOIs are used when there's an interaction between the MAOIs and foods containing tyramine. And foods that contain tyramine include things like avocado, bologna, wine, aged cheese, and overripe fruit. The symptoms of a hypertensive crisis are an occipital region headache, stiff neck, flushing, palpitations, profuse sweating, and nausea. And calcium channel blockers are used as an anecdote. Again, listing some of the MAOIs, just as you saw in Chapter 10, there's Marplan and Nardil and Parnate. This is just a diagram showing that MAOIs inhibit monoamine oxidase, an enzyme that stops the action of neurotransmitters like the dopamine, norepinephrine, and serotonin. Bipolar disorder is characterized by extreme and opposite moods. They can be very low and very high. Patient shows signs of euphoria and depression, or feelings of excitement and calm. Dysphoric signs and symptoms, the same as major depression. symptoms of the manic phase of the bipolar disorder include disordered sleep patterns, activity for days without rest and without appearing tired. The person is easily agitated and aggressive, and they have feelings of exaggerated confidence. So this is during the symptoms of mania, or the manic phase of bipolar disorder. Symptoms of manic portion of bipolar continued, making choices without regard for a long-term plan or consequences of action, attention seeking, unusual interest in sex, drug abuse, including alcohol, cocaine, or sleeping medications, and denial that the behavior is a problem. So with the bipolar disorder, the attempt to stabilize the mood is accomplished with lithium as well as other medications. Lithium anti-seizure drugs and atypical antipsychotic drugs are used for the drug, or for the mood stabilization. And often drugs used in combination with lithium are the most effective in handling the bipolar disorder. This is listing some of the drugs for bipolar disorder, the mood stabilizers, Escalith, and then some of the anti-seizure drugs they mentioned, Tegretol, Depakote. These are the atypical antipsychotic drugs, and they include Abilify, Seroquel, Risperidol, Geodon. This next section is talking about ADHD. So attention deficit hyperactivity disorder presents challenges for both children and adults. And the symptoms of ADHD, which are important to know for the quiz, include easy distractibility, failure to receive or follow instructions properly, the inability to focus on one task at a time, and the tendency to jump from one activity to another, difficulty remembering, frequent loss or replacing of personal items, excessive talking and interrupting other children in a group, the inability to sit still when asked repeatedly, impulsiveness, and sleep disorders. So make sure you know all those symptoms of ADHD, are able to recognize those. Boys' activities are more overt, meaning they're just shown more openly, whereas girls show less aggression and impulsiveness. This is for kids who have ADHD. The girls show less aggression and impulsiveness. They might show more anxiety, mood swings, social withdrawal, and cognitive and language delays. And they tend to be older at the time of the diagnosis. So CNS stimulants are the main course of treatment for ADHD. So they are the traditional therapy, and they stimulate specific areas of the central nervous system that heighten alertness and increase focus. They're able to reverse many symptoms and help the patient focus on tasks. The most widely prescribed one is Ritalin, and many of you have probably heard of that, Ritalin. Patients have to be carefully monitored. It might cause paradoxical hyperactivity, which basically means they're much more talkative. Some of the adverse effects of the CNS stimulants include insomnia, So you want to make sure that you give that early in the day. If a child is taking Ritalin, they take it in the morning so that they can still sleep at night. Nervousness, anorexia, and weight loss. And this is listing some of the CNS stimulants that are used for ADHD. You'll see Adderall there, Dexedrine, and there's Ritalin. There's also non-CNS stimulants. There's no abuse potential, and the most common one is a drug called Strattera. So many of you may have heard of that now as well. They're a norepinephrine reuptake inhibitor. They seem to be as effective as Ritalin. They do have some adverse effects, including headache, insomnia, upper abdominal pain, decreased appetite, and cough. But they do have, the Strattera and the other non-CNS stimulants have the ability, helps the patient to have the ability to focus on tasks and reduce hyperactivity. And there's the Strattera at the top of the non-stimulants, the most common one that is used today.